Welcome to the Hustle Wing podcast. Today we are joined by Mary Tucker, the founder of UPIC Health. She's going to chat to us about her business and her vision, her story, and get to know her a little bit better today. So, how are you today, Mary?
I'm good, Z. How are you?
I'm great. Thank you so much for joining us. Thank you for your time.
Of
So, tell
course.
me, what is UPIC Health about? What is it?
So UPIC stands for Unified Patient Interaction Center, and we started as a call center focused on women's health and
Mm,
have it be a U.S. based call center.
okay.
I have a background. I started in call centers 150 years ago, and was have been part of that industry forever,
Yeah.
and that grew into consumer experience. And my last job before coming back to the States was running consumer experience for global consumer experience for Philips Electronics,
Mm,
and more specifically the consumer products. And it was a long time ago.
yeah.
Um, when the Affordable Care Act went into effect,
Hmm.
I had moved back to the United States, and I was looking for a more meaningful place to do what I do.
Yeah.
Um, and initially, I was working for the Chief Technology Office in the District of Columbia in
Hmm.
their unemployment office, fixing some technology problems at the height of the um, economy bottoming out in 2010, and there were people waiting for their unemployment to be processed for months and months and months and months. It was a mess.
Yeesh.
And then an opportunity to join a national health care women's health organization,
Hmm.
uh, very controversial organization in this country, but an opportunity to join them. They had launched a call center, a centralized call center that wasn't working. So I joined them, and through that work, got knee deep in the Affordable Care Act. And
Hmm.
it became very, very clear, very, very clear in the act that the patient experience, technology, and the use of technology, um, all of these things were going to profoundly upend
Mm.
healthcare as an industry. And fundamentally, I interpreted it as expecting scientists to somehow be business people now, somehow be experienced with, it just, we
Yeah.
see where we are 10 years later, so we can talk about
Yeah.
that in a little bit. So that's why we got started. I just saw an opportunity to do what I do and bring a team together who we could do it a little bit differently in terms of, applying. I don't know if you're familiar with the old company Zappos, but you
Yeah.
know, Zappos was pretty innovative in the call center space. And so
Yeah.
I've, participated in that kind of call center innovation for decades
Mm.
and applied that to UPIC Health. And nearly 10 years later, we're still going strong.
Oh, wow. Okay, so you've been going for 10 years.
Yeah, we'll celebrate our 10-year anniversary October of 2024.
Ah.
We have fielded millions of calls every year.
Yeah.
We now, I mean, we launched a tele admin line via video, where we did triage. I mean, call centers are just, my mission in life is to continue to push forward the idea that call centers are not what people think they are. Their call centers used to be, a place where you could do a catalog sale
Yeah.
or something. They're so not. All that's handled online and by
Yeah.
chatbots. Chatbots have been around for decades, so that's been handled. And the human interactions that happen in call centers are way more complicated now, and they have been for a very long time. And
Yeah.
you add healthcare into the mix, and it gets very complicated. And so, yeah, millions of calls, handling all insurances across the country, supporting over 100 health centers, all with different processes and policies.
Okay, cool. So what is it that you like what does the I want to ask, like, when you call, what is it that you're looking for? Like the customer when they call, what is it that they're
When they
normally
call,
asking?
well, they're actually calling our clients. For any
Mhm.
number of things. So you
Okay.
can think about all of the number of times that you would need to reach out to your healthcare provider. You might
Yeah.
need to be scheduling an appointment. You may
Mm.
have to call the healthcare provider because there's certain paperwork uh, you need to sign and complete, and you have
Yeah.
questions about some of the things that are on there, and you need to do this before your surgery.
Got it.
With us, we were in specialized women's health,
Mm-hmm.
so it ran the gamut from low income sliding scale financial support
Yeah.
qualification, uh, triage, pre surgical uh, support,
Mm.
and consents,
Yeah.
and understanding all of the stuff to ensure we were compliant with individual state laws.
Mm-hmm.
We would handle thousands of video interactions long before COVID ever hit.
Okay.
And we'd been doing this in a couple of states. Insurance qualifications,
Mm.
pre-authorizations, post claim support and collections, everything that
Amazing.
everything admin related to care.
Yeah.
We have demonstrated, and even more so, actually, we've demonstrated it can and should be done virtually. It's cost saving, but it's also value providing too.
Yeah.
Both the doctors, instead of them having to wait 10, or see patients every 10 minutes, they can
Yeah.
actually start not having to run so much of the business and actually get back to the science and what they were there
Yeah.
to do and make us all
Okay.
go, well.
Okay, that's
Yeah.
gorgeous. Thank you. That's beautiful. All right. So what is your vision for the business? I mean, you've been going for 10 years, so I'm sure you've already reached a lot of
Well,
milestones.
we are actually launching, and this is where I need some help. So, because we're small, so I made a very very difficult decision
Hmm.
at the end of 2021,
Okay.
and we implemented it in 2022.
Mm-hmm.
But I terminated the contracts of 95% of my business and laid
Jeez.
off 80 employees
Okay.
over the course of 6 months. Now, and my business is healthier for it right now.
Okay.
And
So
how
what
in
did you do?
how in the world is that possible? How is that?
Yeah. I'm waiting to hear it.
So, we had the huge footprint of client that we supported.
Mm-hmm.
We had a pretty significant ideological break
Mm.
with them over the years, and it became during COVID. It became more most unbearable.
Okay.
So I got together with my employees and
Mm-hmm.
said, I don't know about you, but I'm having troubles
Yeah.
now. And they unilaterally agreed they were as well.
Okay.
So we said, all right, look, um, we have 6 month termination clauses two-way in our
Mm.
contracts. So that gives you guys 6 months. We'll all work together. You'll have any time and all the time you need to get placed somewhere else. I will do
Mm.
everything I need to do, and I'm going to pull the trigger. So we all went forward together. All my employees got placed with the exception of five.
No.
And we're still in touch with a lot of them. We want to grow and have them come back. They're the finest employees I've ever worked with.
Yeah.
It was a very, very difficult decision, but it
Yeah.
was one that then led to my company being a healthier company.
Yeah.
We recognized where our gaps were because we grew very, very quickly. Imagine starting with 12 and ending up with 80 in less than 2 years, and then
Gee.
moving to 100 in year three. I mean, it was just really rapid growth.
Yeah.
So we were able through that. So now we've got our clients that are not eating us up in legal fees because we're having to fight to get paid. We're
Yeah.
not, we have a healthy company with healthy clients. And so
Yeah.
we've decided we took the last year to just breathe into our new normal, which was
Yeah.
a significantly different company. I mean, I everybody that's on the phones with me have been with me since the beginning.
Yeah.
We've been investing in our employees for years. I've launched new programs. I launched a savings program where I match 3% of their salary.
Oh,
We got rid of
wow.
PTO, as I mentioned to you yesterday. We pay 100% medical
Yeah.
and vision and dental. I mean,
Mm.
and that covers, we pay 100% of the kids too, or the
Oh,
families. I forgot to mention that.
wow.
We're a
Yeah.
very equitable company. equal
Yeah.
opportunity for everyone. Right now, I've got the best of the best on the phones, the front lines,
Yeah. Yeah.
providing support to their remaining clients. So we're launching a new line of business and we're hustling because we decided, I moved to Pennsylvania. We regrouped after, just had to just adjust to our new normal. And we said, all right,
Yeah.
now we know what we're doing. It's been 10 years and we have a lot of insight. And
Yeah.
now healthcare is starting to come around. It's starting to recognize their admin costs have been going like this for years. They're
Yeah.
not getting the reimbursements that they thought. We've
Mm.
even done a remote demonstration of behavioral health with health coaches and supported by a clinical psychologist to great success.
Wow.
That all happened during COVID via telehealth. We just
Mm.
sent more of our licenses that we were already using for our video admin.
Yeah.
Anyway, so we're launching what we're calling Ops Lab, and in truth, Ops Lab is it's a marketing angle.
Okay.
Um, the healthcare issues have become so overwhelming
Mm-hmm.
in
Mm-hmm.
this country
Mm-hmm.
that it's almost like we're falling behind from where we were even before Obamacare. We've got
Yeah.
providers are getting sick of it. They're throwing their hands up and leaving medicine. Nurses are striking. It's a really volatile. Admins are striking because they don't have enough. Millions are being spent on consultants to help them navigate
Yeah.
through this. When what
Yeah.
we're saying through Ops Lab is, look, we'll take 5 of the best and the brightest and do a sampling of your calls with and your interactions with your patients, whether it's email, however you do it. We'll
Okay.
put one of our experts in your billing and revenue cycle team,
Mm-hmm.
and we'll do sample support. We'll add supplemental support to your team, so they'll be happy to have us there.
Yeah.
But we'll also help you identify where all of your inefficiencies are, which is all of the
Mm.
patient experience, consumer experience work that I've been doing for decades in my career.
Yeah.
Help them optimize technology. This is what we do for our current clients. So
Yeah.
technically, UPIC is all of that for our current clients. So we've decided to say, as a sales pitch,
Mm-hmm.
say, give us some license. We'll run it through our data. We'll run it through our process. We'll run it through it. And over the course of 6 months, we'll help you know where your gaps are. We'll even
Mm.
help fill some of them real time with your team and
Okay.
measure those results.
Mm-hmm.
Uh, and we're calling it Ops Lab.
Okay.
So two things that I'm pursuing.
Mm-hmm.
One is immediate term, and the other one is long term.
Yeah.
The immediate term is marketing help. I have no idea what I'm doing. I'm not a marketer. It's not my thing. We grew
Yeah.
organically. We never marketed. Over
Yeah.
the 10 years, we went from, I've generated 26 million over the last 10 years in
Wow.
revenue, and that's without a
With
single,
no marketing.
none, a little kind of failed social
Crazy.
media,
Yeah.
no marketing.
Okay.
Okay. We're a great company.
Yeah.
And we've got
Clearly.
lots of clients, even former clients, who will attest to the work we do. We're
Yeah.
very exceptional in the work we do.
Yeah.
And we think Ops Lab is a low cost, high value approach to helping
Mm.
healthcare providers navigate out of this problem.
Yeah.
We also
Yeah.
think would be well suited for consultancies who say, they could say, we think you should do this. And by the way, we're going to sample this process for you with this sample that UPIC does,
Yeah.
and then capture the data real time to show you how right we are. You
Yeah.
know, so we just think this Ops Lab approach, it's low cost. They'll
Mm-hmm.
get the best of the brightest. I
Mm-hmm.
have women who are going through project management certification now that will be part of this, taking
Mm.
the calls, and imagine having 10 years of healthcare admin experience. So
Yeah. That's
marketing
great.
help is my immediate term. And then long term,
Mm-hmm.
and I haven't made a decision about this.
Okay.
Um, and I could use maybe some strategic. I have a great technology company that supports us and keeps us
Yeah.
safe, cyber and all of that, keeps us compliant with our business
Mm-hmm.
associates agreements. But I think we should have a proprietary software that we run this sample data through.
Yes.
And I don't have that, and I want it. And
Okay.
I'm pursuing. I've just gotten a free license to Alpha, and I could use a developer
Okay.
who could help, and then develop on the Alpha platform, which I think is, supposed to be simple enough that non-developers could develop it. Yet I just looked at it and went, as spoken by a developer or a real engineer. They're like, no, 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 this is so easy. Yeah, it's easy to you, Jack.
Yeah. No,
Yeah.
IT
So
guys are
those are
really
the
good
two
at doing
areas
that.
where I could use the dark net. Uh-oh, someone else
Oh.
is joining.
All right, hold on. Thank you so much for your time, Mary. So sorry,
Sure.
Michael.
Hi,
Oh,
Michael. Bye,
Hi.
Michael.
Did I just
Thanks,
like
Missy.
barge in here? Sorry about that, Mary.
No,
you
it was
did a little
awesome.
bit,
We
but
liked it. It was
it's
actually perfect timing. So
Okay.
take care.
okay. Thank you
Take
so
Bye,
care.
much,
Izzy.
Mary.
Thank you.
Bye.
Take care.